and welcome to the 2024 budget hearings for Franklin County, Ohio. This afternoon sessions will include presentations from our Board of Commissioner, Health and Human Service agencies. The first agency to present today will be the Child Support Enforcement Agency.
Good afternoon, Commissioners. I'm Susan Brown, Director of Child Support. Presenting with me today are Bill Peltz, Assistant Director, and Kim Collins, Deputy Director. We're proud to be here today to represent the staff and the work of the CSEA and to present the agency's 2024 budget initiatives and aspirations. In recent years, the child support program has begun evolving from a traditional collection to a family support model. With that framework in mind, the past year has been one of transformation for the CSEA. Through increased parent and partner engagement efforts, relationship building with residents in their community, and collaborative work with our integrated HHS agencies, we continue to operationalize our equity goal through the concept of targeted universalism and human-centered case management. The Rise Together blueprint for addressing poverty continues to inform every aspect of our work, redefining how we serve our residents. As such, our 2024 equity goal remains the same: to move from a one-size-fits-all equality service delivery approach, where the same actions are taken on every case, to an equitable service delivery approach that allocates resources and services based on continued progress toward these goals, as well as our budget, our 2023 agency accomplishments, challenges, and key initiatives for 2024, with each slide containing indicators of relevant blueprint goals and applicable social determinants of health, as you can see at the bottom of the screen. Our recommended budget is $25,847,331. 76% of the budget is attributed to personnel costs and fringe benefits. The remaining 24% is allocated to materials, services, special initiatives, and grant projects. Child support funding is limited to the execution of our core functions, which limits the funding opportunities for supportive programs to our residents, including employment and fatherhood programming. Financial backing for these programs often comes from our sister agencies, JFS TANF, or grant funding, and we acknowledge the Board of Commissioners for their allocation to our budget, as without it, we wouldn't be able to provide the targeted, innovative services to Franklin County residents. The Federal Office of Child Support, represented by Commissioner Tangela Gray, at the 2023 National Policy Forum echoes the current BOC initiatives to embed equity into the culture and policies of child support. In the scope of action for the CSEA, this means supporting the diverse needs of each child, including social and emotional support, nurturing care, and financial support. Ensuring parental responsibility is proportional to parental ability. Helping families achieve the previous two outcomes through fair, unbiased, culturally sensitive policies and practices, including accommodations to parents with barriers to supporting their children. In 2023, we prioritized the shift to equitable, family-focused, trauma-informed child support services. We integrated best practices and data collected from awarded grant projects such as behavioral economics and procedural justice to revise our protocols, culminating in 2 specialized units within our establishment and our enforcement departments dedicated to early and intensive engagement. Additionally, we remain committed to engagement with our sister HHS agencies, including the ongoing collaboration and development of the One Door Project and the referral system for the Men's Empowerment Network. Internally, we promoted diversity and inclusivity across the agency through the evolution of our employee resource groups. Run through our staff-led HR and Culture Committee, the program spans across 9 active identity groups that meet quarterly to offer a safe space for employees to receive support and further internal diversity measures in education. These groups include African American, Latino, LGBTQIA+, parents who have child support orders, women in leadership, mental health in the workplace, disabilities, staff of Christian faith, and young professionals. In 2024, we'll focus on an analysis of our caseload data to provide equitable services to targeted populations most in need of supportive services to provide for their families. To further weave diversity, equity, and inclusion into our framework, our agency has developed 5 core principles that are on the screen. These principles reflect our commitment to redefining agency operations and include learning from our past to better shape our future. We acknowledge and are accountable for the historical policies that have served the foundation that has served as the foundation of our program, and are dedicated to addressing and dismantling the discretionary enforcement tools that perpetuate and punish those in the cycle of poverty. Valuing contributions of all team members, we promote staff engagement in foundational work to establish resident trust and enhance economic stability, including parental engagement, fatherhood initiatives, and community outreach opportunities. Family-focused, individual-centered services. We recognize that individual and family needs are unique, ever-evolving, and that historically, child support policies have perpetuated the generational cycle of poverty. Using caseload data to drive our decision-making, we're determined to reshape the role our agency serves in the lives of our residents. We're committed to diversity, equity, and inclusion, as I previously addressed, using data to support our work and focus on impact. It's imperative that we invest in research and continued data collection to inform the direction of the agency. We strive to gather and evaluate all available data with the goal of understanding and negating the unintended adverse impact our services have on residents of Franklin County. A comprehensive landscape analysis is essential to guide our departments as they work to identify priorities for improvement.
Initial resident contact with the child support program is made through the establishment of paternity, which lays the foundation for parental rights and financial support. Establishing parentage enhances the well-being of children by promoting healthy relationships and providing increased opportunities for father involvement and successful co-parenting. We know from U.S. Census data and the National Fatherhood Initiative that children with involved fathers are at lower risk for infant mortality, low birth weight, emotional and behavioral problems, neglect and abuse, injury, obesity, poor school performance, teen pregnancy, teen incarceration, substance use, criminal activity, as well as suicide. To date, 750 paternities have been established in Franklin County. In addition, paternities established judicially in hospitals and registrars' offices have resulted in a total of 42,780 children in Ohio who have been formally connected to their fathers. When paternity is established, the ties between a child and their parent are strengthened, allowing for greater emotional and financial stability and the decreased likelihood of consequences associated with father absence. A 2023 agency highlight was the creation of an FCCSCA fatherhood team that provided targeted programming, resource referrals, offering listening sessions, and gathering feedback from fathers on their child support process encounters. Often, despite research that indicates program policies should be made in collaboration with residents, designs to improve parent economic stability and relationships are largely driven by the perspectives of program administrators rather than those with lived experiences. In 2024, the fatherhood team will identify new community partners and build robust relationships, expanding listening sessions, incorporate feedback into policy revisions, and finalize the referral process to seamlessly link fathers to the Men's Empowerment Network. There is evidence to show a correlation between parent time with children and consistent child support payments. In 2023, 40 parents utilized on-site FCCSCA mediation services to draft parenting plan agreements tailored to their family needs. This aligns with goal number 12, which is to increase the number of children in safe and stable home and environments, as well as goal number 13, which is to strengthen partnerships with parents to increase support for young people.
Our goal is to foster the ability of parents to provide care and support for their children while addressing barriers and identifying those at risk of falling into poverty. In 2023, our establishment department took this to the next level with the creation of the Early Engagement Unit, or EEU. The EEU implements the findings from our federal Building Evidence in Employment Services grant called The Journey, A Parent's Voice. The study underscores the benefit of strong partnerships between child support agencies and community organizations that provide services to parents with child support orders. Staff in the EEU engage parents on new administrative cases using intensive case management and principles of procedural justice. The goal is to aid residents in navigating the child support process while simultaneously connecting them to appropriate resources. This allows staff to build positive relationships with parents early through proactive, individualized case management rather than intervening after debt has already accumulated on a case, which connects with Blueprint Goal number 12 to increase the number of children in safe and stable home environments, as well as Goal number 13 to strengthen partnerships with parents to increase support for young people. Our goal for 2024 is to integrate early engagement strategies across the enforcement department. Supplementally, a federally backed family input study focusing on identifying opportunities to collect feedback from our families has just begun. This work will inform our policy review and revisions through the lens of those directly impacted, which is an invaluable resource. As it stands, we'll be using surveys as a forum for resident input with the possibility of expanding to in-person focus and discussion groups as well. A unique tenet of our program is the facilitation of the transfer of funds between households. As such, our case management is a long-term endeavor, a partnership between agency and parents lasting 18 years or more. Support orders are calculated based on statutory formulas using a variety of factors, including earnings, to help ensure the amount is within the parent's ability to pay. For families with incomes below the poverty threshold, the child support program functions as an anti-poverty program. For low-income parents receiving child support, consistent monthly payments offer a lifeline out of poverty. Our current caseload serves 100,949 parents and 78,814 children, and our agency has distributed over $145 million to families. This aligns with goal number 12 and number 13 of the Rise Together Blueprint for reducing poverty. Traditionally, when parents do not make their child support payments, they are subject to discretionary enforcement measures such as license suspensions and non-discretionary measures such as the interception of tax refunds. If these amounts do not yield sufficient payment, the parent is at risk for referral to the legal system for contempt of court or criminal non-support. Within our commitment to equity, it is our responsibility to own that our one-size-fits-all policies do not adequately fit the individual circumstances of our residents and may serve as a barrier for breaking the cycle of poverty. To move to a more human-centered approach in 2023, the Enforcement Department created the Intensive Engagement Unit, or IEU. In 2016, the agency began a federal random control research trial called Procedural Justice Informed Alternatives for Contempt, or PJAC, which tested an alternative approach to obtaining child support payments. PJAC integrated the idea of fairness in our case management process using 5 principles of procedural justice: respect, understanding, voice, neutrality, and helpfulness. The IEU is the result and implementation of the PJAC findings. The focus of the unit is on identifying parents with newly established support orders who may have difficulty in paying their support obligation to barriers related to poverty. This identification and support process aims to avoid the pipeline from the CSEA to the legal system, allowing us to work toward Blueprint Goals number 4, improving and increasing the delivery of supportive services for individuals to access employment. Number 6, enabling more families at or near poverty to afford quality housing and reducing the percentage of housing cost burdened families. And number 13, strengthening partnerships with parents to increase support for young people. IEU goals for 2024 will emphasize case management that assists low-income families to navigate the child support program and understand their case. Trained IEU staff will operate in a trauma-informed manner to understand and empower parents to effectively collaborate when appropriate for well-being of their children.
In 2023, the agency was awarded a $1 million Health and Human Services grant to participate in the second cohort of the project, Charting a Course for Economic Mobility and Responsible Parenting, or EMRP. This 3-year grant focuses on Generation Z residents ages 14 to 24 by developing curricula and other outreach and interventions to educate teens and young adults about the financial, legal, and emotional responsibilities of raising a child. The agency and several community partners designed a peer-to-peer approach to delivering the No Kidding Ohio curriculum with the idea that participants will be able to relate to peer educators who have gone through similar experiences. The peer educators collaborate with youth job development programs, foster care transition services, juvenile justice agencies, schools, and more. Through programming with No Kidding Ohio, the agency supports Blueprint Goals number 8, improving maternal and child health among high disparity groups struggling financially, and goal number 11, increasing the number of students at or near the poverty level experiencing academic success. In 2024, the EMRP team aims to continue outreach in youth and young person-centered spaces to advertise programming and pass out targeted resources. As an agency, we serve survivors of domestic violence and rely on financial support for their children. The National Institute of Health states that family and domestic violence affects an estimated 10 million people every year, with as many as 1 in 4 women and 1 in 9 men. According to the Ohio Domestic Violence Network, in 2022, 72,920 survivors in Ohio were provided assistance with legal advocacy, housing, support groups, transportations, and other services. Unfortunately, many cases of family violence still go unreported. In February of 2022, it was found that cases in Franklin County needing family violence indicators were underreported by 8% when compared to the federal case registry. In August of 2022, Ohio was selected as a participating site for the HHS ACF Safe Access for Victims Economic Security, or SAVES grant. Our agency is working on review, administrative, and judicial processes, policies, and procedures to promote safe access to child support services for all residents, including those who have or are experiencing family violence. In 2023, our SAVES team created a domestic violence informed phone system scripting for our call centers, in addition to offering training for grant workers and all agency employees. They have also created a triage team for family safety resources in cases involving family violence, making progress on Blueprint Goal number 12, which increases the number of children in safe and stable homes and environments. In 2024, the SAVES team will analyze policies associated with identifying and marking cases with family violence indicators and will provide a safe space for increased interaction in these more vulnerable residents. Our innovative grant work and outreach efforts allow us to offer an array of tailored assistance and resources to families. As outreach engagements and requests have increased, our team and employee volunteers have evolved to meet the demand. Our growing outreach department regularly provides grant information, child support services, HHS connections, and assists at the mobile unit, community events, resource fairs, No Kidding events, and fatherhood events, along with recurring events at YMCA, Van Buren Shelter, the Compass Court Program, correctional facilities, the March Program, First Step, and more. In 2023, the outreach team connected with the community through more than 120 events and hosted 18 community connection sessions for staff to learn more about our community partners. In 2024, the outreach team will participate in regular meetings and discussions for the One Door Initiative. In addition, the team is aiming to decrease meaningful interaction with residents through an increased community presence and culture of listening and reform.
In 2023, our Planning, Research, and Evaluation team, or PRE, worked alongside CSEA departments to ensure that policy and procedural development is data-driven and includes stakeholder involvement. An example of their innovative work includes an analysis of the data from the Franklin County Prosecutor's Office, the Child Support Case Management System, also known as CETS, and Franklin County criminal court records regarding child support cases referred for criminal non-support. This groundbreaking data analysis enabled the PRE to provide a spotlight on unconscious bias within our legal referral process, as well as to identify a resident profile of those living on the benefits cliff. The PRE discovered that $200 to $300 child support orders are generally low-income, non-custodial parents living on the benefits cliff and are disproportionately referred to court for contempt and criminal non-support. It is data analysis like this that allows our agency to progress and disrupt outdated enforcement efforts to provide an equitable experience for families. In 2024, the PRE intends to complete additional project planning as well as policy and procedure analysis to improve service delivery for residents. In addition, they intend to evaluate department performance and engage in equity plan development.
Progress and achievement involve acknowledging and overcoming obstacles. The challenges we experience can be used to inform preparations for tomorrow. This past year has brought numerous hurdles, including the common theme of one that every HHS agency has experienced: employee recruitment and retention. In 2023, we improved our training protocol based on new hire feedback by increasing practical application and scenario training. Even with this progress, our current full-time equivalency is 219 out of 268 total budgeted positions. With approximately 49 openings across various departments, our training staff are over capacity due to the high turnover rates and constant flow of new cohort training. Our training department is running at capacity. In 2024, agency leaders and supervisory staff aim to identify and remove the employee barriers to long-term employment with the agency. We know that our employees are also residents of Franklin County, meaning they face the same challenges, including access to safe housing, affordable and reliable childcare, and public transportation. Part of this improvement involves emphasizing employee wellness to provide the highest level of care to themselves and residents. Another major challenge involves resident participation in our program. Despite our large caseload, many of our parents are apprehensive about engaging with their caseworkers for various reasons, including the agency's negative reputation and fear of retributive action from the agency. Politics, stereotypes, general assumptions, and government reports continue to have influence on health and human service programs, including child support agencies. Many of the original traditional practices of the program still exist, which include factors that may create barriers for families accessing services, affect parent success in the program, and perpetuate poverty. To work toward dismantling these barriers, we need program advocacy and additional agency trainings to disseminate information about how our program impacts residents, our constantly changing policies and procedures, as well as how to mitigate them within each employee's sphere of influence. In addition, we need to increase presence out in the community and outreach, as well as talking with people with lived experiences for feedback and to engage in stronger recruitment strategies. We're motivated and dedicated to the implementation of the One Door to provide wraparound services for our residents, to grow trust and positive interactions with our residents and the other HHS agencies.
The agency's performance spotlight measure is the percent of current support obligations collected on time. In federal fiscal year 2023, the agency distributed $146,315,815 to families as current and overdue support. For federal fiscal year 23, the CSEA provided 66.41% of current support to families in the current month due. According to the U.S. Census Bureau, in 2022, 14.3% of Franklin County's population lived in poverty. These children are at greater risk of experiencing economic hardship. Lack of income can reduce the quality of residents' social determinants of health, which can be detrimental to the success of the child. Receiving child support means families can pay rent, mortgage, and utilities, buy groceries and clothing, provide health care and other costs associated with raising a child. This measure was selected as the agency continues to embrace a holistic approach to serving families by improving and increasing the delivery of supportive services for individuals to access employment. Addressing this issue supports Blueprint Goal number 4, which is to develop and invest in programs that provide long-term personalized employment services to help residents transition to and succeed in employment opportunities. Providing supportive health and financial security to vulnerable populations helps prevent child abuse and neglect, ensures that children can develop to their fullest potential, and reduces juvenile behavioral problems.
Finally, I want to express my deep appreciation for the support and guidance that DCA Bivens, County Administration, and the Board of Commissioners have shown to our agency. I also want to thank our dedicated, committed, compassionate, and driven staff. The work that we've described was conceived, designed, and fulfilled by them. There is so much more to report about the work of the child support program, but due to time constraints, I'm unable to report it all. As such, we developed a supplement to our testimony that lays out more of our work in greater detail. I'm excited about what's ahead, and I'm honored and grateful to be part of Franklin County and our child support team. Thank you, and we welcome any questions.
Thank you, Director Brown. I believe they're going to play your video.
And I don't believe the sound is working.
Director, were you able to see and hear that video? It's unclear on our end if you were.
We were able to see the video. It sounded like a broken down carousel, but so the catchy tune didn't play, but the slides played fine.
We can move the questions though, Madam Clerk,
Okay, great. Thank you.
with the County Administrator and the OMB Director.
I'd like to thank the agency for that very comprehensive testimony of your work. I have a few questions and comments, but I want to defer to any questions from the Board of Commissioners that are logged on the meeting before going to my questions, or DCA Bivens questions, or County Administration. Okay, I don't think we have any questions from the board. Director Brown, I appreciate the emphasis on outreach. I think outreach is extremely important. I think that has been one of the things that's been a differentiator for our child support enforcement agency versus traditional agencies. We have always tried to go out of our way to be community oriented, to try to take away some of the stigmas that have been attached to child support historically. You've been innovative as a director in behavioral economics and working with the entire family. One of the things that I miss that I hope that we can bring back on the community outreach side is our empowerment day that we haven't had in probably four plus years. I think that event now can be even amplified because we have a combined HHS family along with our nonprofit partners. I think that event had a reputation that it didn't create an environment where people felt intimidated to show up, to try to work with us.
Thank you, Administrator Wilson. And it has been since the pandemic, we haven't had an in-person empowerment day, but certainly with our integrated HHS agencies, I think that Empowerment Day event could be even more comprehensive and better than ever. So I look forward to planning that event. And I agree that community outreach such as Empowerment Day and being out in the community with the rest of the HHS team and going to community events, that's the only way that we are going to break the stigma and the stereotypes that are so long associated with child support.
And if you had a magic wand, what would you do more or differently as it relates to filling the vacancies that exist in the agency?
If I had a magic wand, they would just be all in my agency and completely trained. But I think you know, it's a complicated question, because even if we were to even if we were to hire 40 people today, we would struggle with training capacity with the cohorts. I think that we need to continue to be persistent. We need to continue to go to hiring events. I think we need to go to places of higher education to recruit individuals who would like to have a career in public service, both at the high school level and the college level. So a magic wand, I guess, to have enough resources to be able to recruit and onboard all the individuals that we need. But not only that, my magic wand would include that, as I said, our staff are also residents of Franklin County that have the same barriers and obstacles as everybody else. And we spend a lot of time with our staff, helping them to be successful, to helping them to remove barriers. So we look forward also to Future Ready to help us navigate, help our new staff navigate this new environment.
Okay, thank you. Now I will yield to the leader of the Health and Human Services agencies, DCA Bivens.
Thank you, County Administrator. Director Brown, can you just really highlight, I saw percentages based on the 200, 300% benefits cliff, but can you highlight the actual number? How many obligors are impacted by felonies per year based on that benefits cliff?
Impacted by felonies. We have that information,
Okay.
DCI Bivens. I don't have it directly in front of me.
Okay.
I have my legal services manager is on. I could tell you how many felonies or cases that we have referred to the prosecutor's office, but then we would also have to then match that data with their support orders to determine. But I would venture to say, and Lizzie, if you won't mind jumping in on this, because you did the criminal non-support analysis, you may actually know the answers to that question. That, of those cases that we referred to criminal non-support, how many of them had orders $300 or less?
Sorry about that. There's a little delay there. Hi, Deputy County Administrator. I'm Lizzie Haygood over here at Child Support. And one of the big data dives that we did over here was comparing criminal non-support orders to the benefits cliff. And so I don't have a direct number right in front of me right now, but I do know that the population of orders between $200 to $300 a month in our total caseload is about 10% currently. But then when we were looking into how many of those cases were referred for criminal non-support, they made up about 47% of all cases that we referred to criminal non-support. So again, we don't have exact numbers. We can get those over to you, absolutely, but it's about 47% of all cases referred for criminal non-support.
Thank you, Lizzie, and we appreciate that information. And when you send that information over, can you let us know how many children are impacted by that 47% or that 10% in Franklin County as well? And then would you say that are these obligors more men than women or more women than men? Do you have any demographical information on those residents?
Yes, so it is more men than women. For all orders under $300 in our total caseload, we have about 36,000 men that are below $300 a month and about 5,000 women. About 200 are unknown or preferred not to answer. So it's definitely more men than women impacted.
In causation, you would say, is it lack of education or lack of employment or? Okay.
So we did a complete analysis using the Ohio benefit system, and it's all of the above. So most people are not employed. Most people cannot qualify for TANF funding or SNAP benefits. Most people do receive Medicaid. We have all the statistics and graphs for you that we can provide to you for more specific data, but yes, it's all of the above.
Please do, and thank you so much. And County Administrator and the Board of Commissioners, the reason why I highlight that information is just for you all to see the interconnectedness of the HHS agencies and the causation of many of the reasons why people are in that benefits cliff level. Thank you.
Thank you, and thank you, Lizzie. She's our management analyst too. And this is really the direction that we're going, that we're really diving into this data in order to make policy decisions and case management decisions. And we're only at the tip of the iceberg with this work. We have a lot more to delve into.
This is Kenneth Wilson again, an administrator. You talked a lot in your agency presentation around equity through your procedural policies and making revisions. In working on your first equity plan, what would you think was your most important takeaway to this point? And where do you see the greatest challenge when you look at the child support landscape?
Our our biggest highlight of that is really looking at our families, our parents, from a human-centered approach. That, you know, our program historically in the past has been a cost recovery program. It's been established the highest order, you know, possible so that child could be successful, but there was never a deep analysis into the impact of what we were doing to individuals and families by practicing, you know, these strategies. So that the equitable approach is really looking at each individual based on their own individual circumstances. In that development of the early engagement unit, where we've changed child support establishment from totally process oriented to a case management approach, to looking at these cases very early and helping people to navigate the child support system so that they understand it, so they have the information to make good choices. And then also the intensive engagement unit is another indicator that we're recognizing that 34% of our caseload needs intensive supportive services, individualized case management. And we also learned that through our behavioral economics grant, our procedural justice grant, that it does, you know, parents didn't get in the situation that they're in overnight. And it's not going to be resolved with one touch or two touches. It's going to be resolved with years of partnership with that parent. And that doesn't mean us telling a parent what to do. That's a true partnership to really understand what that parent needs based on their own experiences. So that's probably the biggest highlight of the initial stages of our equity plan. One of the biggest challenges is our brand, you know, our reputation, the trust in the community. Is that, you know, sometimes no matter how much that we go out into the community, you know, parents will say, oh, I got child support put on me. You know, like it's not even a service. It's some sort of oppressive punishment for being a parent. And we really need to promote the program as a family support program. This is all about the family. And this, in the center of it, should be the child. And that both parents should be, you know, looking at, you know, child support or even the support that they need within their own family, you know, to be able to lift up that child so that child can thrive. And no matter what your differences are, no matter, you know, how retaliatory you want to be because you're upset with the situation between the parents, you got to put that child in the center of it and work collaboratively.
Thank you so much, Director Brown, to your team for your extensive overview. If you could get that information to us so that we can, you know, as we continue to, you know, look at the budget, that will be very helpful. But you all did a phenomenal job, and thank you for your time today.
Well, thank you all for all of your support. We couldn't do this work without the HHS team. And without the support of our really progressive BOC. Thank you.
Thanks, Susan. And if there are no other comments or questions, that will conclude today's presentation from Child Support Enforcement. Commissioners and County Administration, we will next hear from Job and Family Services. However, we will need a couple of minutes to get everything set up. So we will begin here just in a couple minutes. Thanks.